Good day everyone, I'm Karen Discutibak from Batch 3 SAS and Lipat Caregiving. For my today's video, I'm going to demonstrate you on how to assess a vital signs of an infant.
When collecting vital signs on an infant, you will want to keep the following in mind. Start the most non-invasive vital signs first. The sequence for assessing an infant vital signs are respirations, heart rate, temperature, weight, the length, the head circumference, and chest circumference. We have the supplies needed: the infant size stethoscope, watch for counting, thermometer, scale, and measuring tape.
All we need is sanitize the supplies before and after use. Perform hand hygiene before and after assessment.
I'm going to start for the respirations. The normal respiratory rate for an infant is 30 to 60 breaths per minute. Assess for any signs of distress. And make sure there is no nasal flaring. And also look at the chest. You need to look anything like chest restrictions. And then look at the skin color and make sure it's appropriate for the skin tone. And be sure you don't see any sign and symptoms of cyanosis. What are we going to do is to count for 1 full minute. At this age, the rate is irregular, so you need to count for 1 full minute. Infants have what's called periodic breathing. This is where the infant breathes and stops for a few seconds and then breathes again. And watch the rise and fall of the chest, so 1 rise and fall equals 1 breath. And infants like to breathe normally, so watch the area or lightly place a hand on the area while counting. So here we go, 1, 2, 3, 4, 5, 6, 7. So you wanna count the rise and fall for 1 full minute and document that number. So her respirations is 38, so the normal breath is 30 to 60 breaths per minute. And for the heart rate, use an appropriate size diaphragm and bell for an infant. So the normal heart rate, if less than a month, the normal infant heart rate is 100 to 190 beats per minute. And this is appropriate if the baby is sleeping and crying. So if the infant is 1 month to year old, the normal heart rate is about 90 to 180 beats per minute. Count the apical pulse by counting for 1 full minute. So the apical pulse on an infant is found at the 4th intercostal space, at the lateral to the midclavicular line. So you are going to find the clavicle, and I'm going to the 4th space. So this is the apical pulse of an infant. And I'm going to put the stethoscope and I'm going to listen for 1 full minute. And now the infant's heart rate can experience sinus arrhythmia, which is associated with respirations. So the heart rate speeds up and down with respirations. That's why I'm going to count for full 1 minute. So the heart rate is going to be fast. One thing that will going to help me is to find the heart rate. So I'm going to tap my finger along with the heart rate in count. The heart rate is about 142 beats per minute. To check the temperature of an infant, the route taken is through the armpit axillary. The normal temperature of an infant is between 97.5 to 99.3 Fahrenheit. So we are going to place the thermometer tip in the armpit of the infant. To check the temperature, place the tip of the thermometer within the fold of the armpit and close the arm and wait for the thermometer to beep to tell you the reading. When the thermometer is beeping, check the reading, and the reading is 99.1. And we're going to document this, and this is the normal range. To check the weight of an infant, remove clothing and soiled diaper and keep a dry diaper on the infant. Place the infant on the scale and obtain weight and compare current weight to the previous weights. And document the weight. To measure the length, what are we going to do is to lay the baby that you can mark for this, and it may need someone to help to hold the infant. And I'm going to measure from head to heel and place paper behind infant to mark length areas. Lay baby back and keep head midline and extend the leg. And mark these areas on the paper. And measure it with measuring tape. So the normal length of an infant is 18 to 22 inches. And then I'm going to measure it. To measure the head circumference, we need a measuring tape. And what we gotta do is place the measuring tape around the largest diameter of the head that is found around the forehead and just above the eyebrows and the prominent part of the back of the head. So her head circumference is about 37 centimeters. To measure the chest circumference, use measuring tape and measure in centimeters. Wrap the measuring tape around the infant's chest and use the nipple line as a guide. The chest circumference should be about 1 to 2 centimeters less than the head circumference.